ladies and gentlemen. It is a great honor and a privilege to be here in the capacity as a Minister of Health in the Republic of Macedonia. I have welcomed the opportunity to address to you all at the heart of Europe. Before I begin, let me express my sincere gratitude to the Health Consumer Powerhouse for this extraordinary and a unique opportunity. 2014, what a year. A year when whole of Europe and the entire humanity felt the greatest pride, anticipating one of the most historic news of the 12th of November 2014. The Rosetta mission of the European Space Agency was successful in the Philae landed on the comet 67P. Despite the fact that the Republic of Macedonia at present does not participate in the European Space Agency program, we felt an extremely joy for such an achievement. I truly believe that I will see the day when my country will take part in the European Space Agency programs. It is interesting that the term conquering the universe is one of my favorite say. We all know that the implementation of the healthcare system reforms is not easy, and I quite often hear, there is no way you can do that. So without exception, my answer is, if people manage to send a space probe to a comet or a planet so far in the universe, there is nothing in our healthcare system that we cannot change or improve. So what is the secret of the rapid improvement in our healthcare system performance? I do not believe that I would reveal any spectacular secret, because we simply adhere to the basic rule of management. Any company, medical institution, or state health system cannot be managed without measuring its performance. We realize that healthcare activities and processes ought to be measured, and therefore an integrated health information system was urgently needed. The National System for Electronic Medical Evidence incorporates the medical institutions from primary, secondary, and tertiary healthcare level. As of 1st of July 2014, patient referrals for medical specialist care and diagnostic examination are performed only electronically. At the same time, patients can choose the time of their appointment, as well as the doctor and the medical institution. The implementation of the electronic system allows us to identify areas of improvements, such as waiting times and reasons for prolonged delays, such as lack of specialties or lack of equipment, as well as, in some cases, is due to subjective factor or bad organization of work activities. Managing the identified flaws contributed to increase access to the healthcare services in the Republic of Macedonia, as well as significantly decrease the waiting time in certain medical specialties. As a Minister of Health, I have to admit that this is a lot easier to manage the healthcare system through analysis of a large data and information collected through the National Electronic System rather than managing it in the dark. Additionally, we implemented the compulsory use of electronic prescription, electronic central register for medicines containing the required information for the patients and the health professionals. We made a significant rationalization of the cost through implementation of a new methodology for medicine price determination. We managed to lower the price of around 4,000 medicines and made an astonishing financial savings of approximately 36 million euros. Additionally, savings were made through a parallel import and centralized purchase system for expensive medicine, insulin therapy, lens, laboratory reactants, and other. On the other hand, antibiotics without prescription can no longer be obtained. Along with establishing the National System for Electronic Medical Evidence, we implemented changes that contribute to increase the effectiveness of our healthcare system. For example, in the last 2 years, the medical institution performance are measured through the balanced scorecard system that consists of the following 4 areas: finance, patients as users for the system, clinical focus, as well as development and education. This year, the system of strategic planning and management is included in the healthcare law. Firstly, the National Balance Scorecard is created. Subsequently, the balance scorecard for each public medical institution is generated. The evaluation of the medical institution achievements according to the development indicators is in fact evaluation of the medical institution's management, comparing the achieved result with the planned result, which means that the additional finance for each medical institution depends on the realization of the set tasks. The finance may vary between -20 to +20% of the basic salary. In addition, management evaluation according to the achievement started 2.5 years ago. Specialized of secondary and tertiary healthcare level are specialists on the secondary and tertiary healthcare level are paid on the basis of achieved labor output in the frames of -20 to +20% of the basic salary, while specialists with a bigger labor output on national level are announced publicly and awarded with the additional salary, one additional salary. In fact, balanced scorecard and labor output payment are integrated function and a composing part of the national system for electronic medical evidence. It is extremely important to mention that in the last few years we have invested in the most advanced medical equipment in the value of over 100 million euros, including most advanced computed tomography, magnetic resonance, digital X-ray machines, laboratory ultrasound, and so on. Also, we have performed reconstruction for or construction of many medical institutions across the country. Now, we are working on one very big project, and we are in the process of building of a new clinical center, Mother Teresa, in the same city where Mother Teresa was born. This is probably the largest infrastructure project in the Macedonian healthcare system so far. During the last 2.5 years, with a view to implement new medical methods, improve patient care, communication skills, and establish contact with professionals from around the world, more than 1,000 healthcare professionals, many of which are specialists, as well as nurses, X-ray technicians, were trained and educated in many prestigious and eminent medical centers across the world. Meanwhile, many well-established medical experts from abroad who live in Macedonia have made an incredible contributing toward implementation of new methods and procedure. With regards to this, I would like to point out that the establishment of the new neonatal cardiac surgery unit in 2013. In the beginning of 2013, we also adopted the law of medical studies and continuous professional development, which included part of professional exam to be taken with the medical simulation center. This law also included compulsory videotyping of all endoscopic interventions and certain open surgery procedures. For the first time, we established national specialization and subspecialization plan, as well as significant increase in their number. We allowed specialists from private medical institutions to pass to public medical institutions, as well as Macedonian specialists from OECD states to come back to our healthcare system. In the past period, we had a record-breaking number of new health system employments, around 2,000 in 3 years. We have purchased new most advanced vehicle for emergency. We have adopted protocols and provide training for emergency personnel. We have adopted over 1,000 clinical guidelines and many clinical pathways. We have established exam for medical institution managers, hospital culture protocols, as well as continuous evaluation of the patient satisfaction. Furthermore, with the last changes of the healthcare law that have recently been adopted, we established an electronic national accounting system, which will integrate it with the national system for electronic medical evidence, and it will account for medical supplies, begin use for each patient. Also, it includes national pathways for malignant diseases that determine the maximum waiting time for each medical services for these patients from the moment of disease diagnosis and during the whole period of treatment. It is important to notice that we are implementing serious changes in the way specialization are performed in order to increase their quality through establishing intermediate exam and colloquia on each round, compulsory education literature used on the top 10 universities according to the Shanghai list in the area of medicine, determining the minimum number of intervention, examination or operation that each trainee doctor has to perform, as well as learning 2 foreign languages during the specialization, among which English is compulsory. And finally, we include a compulsory stay of at least 3 months within a prestigious medical institution in the European Union or the United States before gaining the specialist title. We are also planning to form a national committee for diabetes mellitus, aimed to controlling the uncontrollable waste of expensive insulin, and at the same time aimed at strict adherence to the national guidance in order to improve the treatment of patients with diabetes. With these changes in the law and the enabling of easier cadaveric transplant performance, we have increased the number of kidney transplants, although in this area we are still red, according to the European Healthcare Consumer Index, and there is a space for improvement. Another important fact is that after the previous increase of salary of the specialists in public medical institutions on secondary healthcare levels, we have recently increased the salaries of specialists of the tertiary healthcare level for approximately 25%. I would like to point out that the European Healthcare Consumer Index represents an extremely valuable tool for us in the aspect of continuous improvement, as well as for comparison the other healthcare system in Europe. Yeah. Interestingly, the European Commission experts with the EU Twinning project for strengthening capacity of the Ministry of Finance of the Republic of Macedonia for macroeconomic analysis and creating policy have used the European Healthcare Consumer Index as a credible index of comparison between the health system in Europe. It is worth mentioning that before we started our system reforms, we were guided by the vision to establish patient-centered healthcare system and to focus all our activities on the patient. Finally, despite the significant improvements in our healthcare system, we are aware that we are still behind the leading European health systems in the aspect of health outcomes. The key set of indicators for that reason each of our activity regarding the patient rights and information, the accessibility of health services and medicine, and even the range of health services and prevention, is performed with the view to improve the patient's health and prolong the quality of life of our citizens. We have a long road ahead and still aiming to implement the ongoing project as well as many projects and many new projects to come. Ladies and gentlemen, as I have already mentioned, things are not great in the Macedonian health system. There are still certain unsolved problems or dissatisfaction over certain issues among patients and doctors. There is a desperate need for reconstruction and renewing of the medical infrastructure, the need for purchasing of additional new medicine equipment, and increasing the availability of the latest generation of medicine. The health system represents an area that has many challenges. There is not a health system that does not have its own setbacks, and therefore we have no illusions that the Macedonian healthcare system is or ever will be free of such challenges. In my opinion, the key to overcome these challenges is to precisely and strictly find the problems and work on their solutions. Quite often, problems arise due to seasonal changes, sometimes on a daily basis, and therefore, no matter how many problems you solve, the new ones emerging every day. I'm well aware of the problems in the Macedonian health system. However, so far, my team and I, including my predecessors, have worked through many challenges, but yet there are many more to be solved. Our struggle for better and higher quality health system is eternal and timeless. The struggle continues. Nevertheless, every day we make a small change that changes someone's life. For that reason, we are not going to stop. Thank you very much. This is the system.
we can't, of course, let you step down before explaining what are we watching here. And I guess everybody thinks, will we be staying to see the number request break through the 1 million wall? So please tell us, what do we see?
This is the system that I have spoke about, and this is the system in real time. Actually, these are the requests per second in this moment. And these are the referrals that are issued in this moment. And these are the number of prescription and the type of prescription that are issued in this moment. So you can see that starting from this morning.
Yes,
this morning, we have 9,045 now referrals, 47, 8, and about 15,372 prescriptions. So there are top generics that are prescribed and top ICD-10 diagnosis. And this is in this moment. So in every moment, by click of a button, we can take this information, or we can see what are the top diagnoses today, or what are the top diagnoses in the last 30 minutes, or what are the top generics in the last 1 month, or today from 11 to 12, or from 9 to 10, every day. So this data is helping us to create a policy and to manage the whole system. This system is helping us to see where we have a problem. For example, with a lack of terms, or a lack of specialties, or we need to procure new equipment, or maybe we should do some organizational change. So this is the system that we have. Thank you.